Hi, hello, this is Dr. Steele. Today's questions ask is if I can analyze and clarify vitamin D deficiency. As a reminder, I am not diagnosing or treating anybody. In this video, only discussing medical topics like this. So 7 years ago, more or less, vitamin D, we started testing for it, and we have no ways of knowing back then if we were deficient. We thought just by, putting vitamin D in food and sunlight would take care of that. But unfortunately, that was not the case. So nowadays, most of us are deficient in vitamin D. And vitamin D is one of those vitamins that act like a hormone. In order for you to be able to absorb calcium in your gut, you need to have vitamin D. So think with me. So you need to have vitamin D in your blood for it to act in your gut cells for them to absorb calcium into your bloodstream. From there, it's going to go and get distributed across your body. And the main place that we're going to find calcium is going to be in your bones, as you know. But think with me. When we talk about calcium, we're talking about an electrolyte. An electrolyte, E for electricity, is also very important for that electrolyte to be present for our cells to function. So patients that have lack of vitamin D, by default, have a lack of calcium in their blood. And since you're deficient in calcium, your bones are going to suffer because your body is very smart. You're going to say, I need calcium, so I'm going to take it from your bones. So what's going to happen in the long term? We're going to have weak bones. We're going to have more arthritis. We're going to have more osteopenia, which is lack of calcium in your bone before it becomes severe enough and it turns into osteoporosis, as you know. Remember also that when we're younger than 50, which I'm already there, we're like basketballs. We fall and we tend to bounce back. But after 50, we turn to jars. We fall and we break more easily. So that is why it's important to take your vitamin D. Everybody's different. I choose to give our patients 5,000 units every day. But of course, discuss this with your doctor. But again, it's not about the amount, it's about taking it. Like one of the patients of my dad, he said, doctor, when should I take my medications? Just take them. Or my supplements, just take them, all right? So let's go back to the electrolyte story. So those cells function and they need calcium to work. E for electricity, E for electrolyte. So calcium is involved in a lot of biochemical functions. And they call it electrical chemical functions. So if you don't have enough vitamin D, the other organ that suffers as well is your muscles. Your muscles need calcium to work. And if you're deficient, your muscles they're as strong as they could be. So most of those patients had a higher risk for falling. And surprisingly, they're also at risk for body aches. They call it bone pain or muscle pains because calcium is very important. Also remember, your heart is a muscle. You need calcium for it to pump the blood. And I always tell my patients, the heart is important to pump the blood out, but your legs are important for you to move them because the second heart of your body is not your heart. Those are your legs, right? Every time those muscles contract in your legs, they're pumping the blood to your heart. And of course, the heart is pumping the blood to your body. And of course, I mentioned if you have lack of vitamin D that leads to lack of calcium, those bones are those bones, of course, and also your muscles are weaker. So people have something called in medicine proximal muscle weakness. They have a hard time raising from the toilet. They have a hard time raising from a chair. So again, it is important for you to take your vitamin D. Now, also think about this one. Electrolyte, electricity, brain. It also affects your brain. So a lot of our patients, when they come to see us, sometimes they have mood disorders. Feeling sad, feeling anxious, not able to sleep well. Well, vitamin D deficiency can give you that. And it seems so simplistic, just take a supplement, right? A supplement is called a supplement because it's not like a medication. It's not activating or blocking anything. It's actually just supplementing what your body needs. Now, also for you ladies, the hair needs calcium to be made. And the skin needs calcium as well. So it is important to recognize that if you have weak skin or weak mucous membranes, patients are at a higher risk of getting infections. In this case, due to the pandemic, it's recommended for you to take vitamin D, besides vitamin C, zinc, and so on and so forth. But the main one is vitamin D. So it is now recognized that vitamin D deficiency increases the risk for many chronic diseases. Cancer is also been linked to vitamin D deficiency, autoimmune disorders like lupus, rheumatoid arthritis, Hashimoto thyroiditis, and your thyroid. For me, type 2 diabetes is much easier control when you have vitamin D on board and you're not deficient. Heart disease, I mentioned your heart is a muscle and needs calcium to work. Hypertension, your vessels need calcium for them to relax. So people that have high blood pressure, they need to take vitamin D. Infectious diseases, including upper respiratory tract infections and tuberculosis, for what I just mentioned to you. Remember, those shields, your mucous membranes in your skin, are very important to take care of. And I mentioned to you arthritis, and it has gone to be such a problem also with patients with severe mental disorders like schizophrenia. They also need vitamin D. Also, remember, people that are higher risk for vitamin D, surprisingly, is people that are dark complected. So the darker we are, the more vitamin D supplements we need. And most patients tell me, Dr. Steele, what about if I work outside all the time and I'm in the sun all the time? How come I need vitamin D if I'm out there all the time? Because you need to be, the surface area of your skin needs to be exposed. In other words, you need to be naked for 15 minutes or 15 to 20 minutes every day to have enough exposure for that vitamin D to also work with the sunlight. Not to say that you should not do that, but for me, it's better for me just for our patients to take supplements because I don't want radiation from the sun and skin cancer and so on and so forth. Well, those are my thoughts on the diabetes and the link of vitamin D deficiency. Please put any opinions or thoughts on the section below. They always generate an interesting dialogue. As always, I hope you found my analysis on these topics to be interesting. Thanks for watching. And remember, the greatest wealth is health.